Hi, this is Dr. Vidya Patil. I am the director of Arya Fertility Center and Arya Women's Healthcare Center located at Kandivali West in Mumbai. So this is our embryology lab, and here we have a complete analysis system where we analyze the semen analysis. We also give reports and wash the semen for procedures like IUI, IVF and ICSI. So this is an automatic analyzer which we use for giving patients an elaborate report, and we label the semen. Suppose it has to be frozen, it is frozen and kept in these storage tanks, and these storage tanks basically have liquid nitrogen in them, and this can be kept for several years as well, as long as we need the sample of the semen as well as the embryos and oocytes. Many women require oocyte freezing as well, and because they want to defer their pregnancy to a later date, they do not have the ideal partner, or for various career reasons they need to postpone their pregnancies, or in some cases where there is cancer and unfortunately it's a young girl and she wants to preserve her fertility, then her oocytes as well can be very well preserved for use in a later date. Welcome to our OT, which is a oocyte pickup room, and also the embryo transfer room. So this is the place where we do the ovum pickup of patients who have been stimulated for IVF cycles. So this is a setup where we have the anesthesia trolley, which caters to even a general anesthesia if in case required. It has an inbuilt ventilator along with sevoflurane gas, which is extremely safe in case there is an emergency and we need a deep anesthesia. Of course, most of these procedures we do under total intravenous sedation and if required under spinal anesthesia. We have entire unit which is set up with a central oxygen and CO2 and tri-gas system so that we curtail outside infection coming inside the lab. The walls that are used are also silver impregnated walls, which are antibacterial walls. So the table that is there is hydraulic table, and it is it takes various positions for various difficult cases which we need to pick up. So we have these Dr. Mac lights which are very malleable, and they also have a very safe light for embryo pickup. So we have a fantastic system where we do the pickup with this with the help of this oocyte pickup pump. Now there are separate there are units like this which are warmed. So these are meant to keep the test tube warm while the pickup is carried out. Many a times when it is held in hand, the test tubes get cold, and that can compromise the oocyte, that is the OCC or the oocyte cumulus complex. So this remains safe because this remains warm for at least 2 minutes. So while we change our tubes and while we transfer, so our staff can transfer directly into the warmer on this side, and the embryologist can take through the pass box on the other side. So all the safety measures for maintaining the world class standards has been maintained. We have maintained a positive pressure across this vent, so that the embryo lab is more positive as compared to the pickup room. So you can come into the lab. Welcome to our embryology lab. So you can see that we have a laminar flow here, and this is the microscope where the scanning of the oocytes is done, where once we do the pickup, the OCCs, that is the oocyte cumulus complex, is separated from the follicular fluid, and it is put in a Hippies media. So the whole lab is centrally monitored, and we have a unit here which tells us how much of CO2 is there, how much of VOCs are there, how much of particulate matter is there. So this is a very good system which will keep the control of the lab in a proper manner. scanned and put in a Hippies media. Once the OCCs are scanned under the microscope, they are kept into this Hera cell incubator for some time before the oocytes are retrieved, and they are scanned from the OCC complex and they are taken up for either IVF or ICSI. This is our ICSI system. This is a higher end ICSI system, and it is a completely automated system where the arms come and completely sit on the stage, and it is very easy for the embryologist to work on this particular system, and it really improves the quality of the work that the embryologist does. Once the ICSI is done on this particular machine, that is intracytoplasmic sperm injection. Now this is done with the best of the sperms that are seen, and with the oocyte that is scanned. There are mostly M2 oocytes. The mature oocytes are, the procedure of ICSI is carried out on those, and once that is done, we incubate the OCCs in this particular machine, and you can see that there are two different compartments in this particular machine. This is the Aztec incubator, which is a benchtop incubator, and two separate compartments, and they are completely sealed, so it remains warm on the up and as well as the bottom, and it maintains a proper environment for the embryo's growth. And we are able to get fantastic day 5 blasts along with all the system. Here too there is a completely antibacterial cladding. This is a silver impregnated walls, and which prevent infection. You can see that we have these trigases and CO2, which are completely centralized, and the whole system is outside. There are proper filters which any lab would have. So the filters filter all the gases which come into this particular system. We have air filters in addition to the HEPA filter that is here on top, and this filters keeps a fantastic air quality in the lab. So with all this, we expect a fantastic results for our patients. All we want is pregnancy for our fantastic ladies who are suffering from infertility, and there are many socio-economic and there are so many other things that the woman is facing, and we try our best to help them. So this is our recovery room, where post pickup our patients can lie down and they'll be here for recovery for maybe 3 to 4 hours or more. And even after the embryo transfer is done, we keep the patient for some time for rest, and then subsequently the patient can go home. I hope you like the setup. Thank you. So this is a place where we do our sonographies. Now this particular machine is a Voluson S8, which has a 3D and 4D facility. So we can evaluate the uterus very well, the endometrial blood flow very well, and the fetal scans also take place. So small procedures like IUI also can be carried out in this place on this particular table. So we have a complete setup, including IVF, IUI, sonography, and our laparoscopy unit is on the first floor of the hospital, where we have a complete setup for not only deliveries but also for high-end laparoscopies and also cancer surgeries related to women. We have general surgery facility where we are operating on gallbladders, appendix, and many other surgical conditions as well. So we not only do laparoscopic surgeries and deliveries, but we also have facility for cancer surgeries and cosmetic surgeries and any other surgery which requires laparoscopy, that is gallbladder surgeries and appendicectomy, etc. We are associated with very good doctors at a super specialty level. We have urologists and gastroenterologists as well. Thank you.